In 2007, I had a diabetic fit at the wheel and hit a brick wall at 70 miles an hour. So subsequently, I broke both femurs really badly and shattered my left foot. So I was in hospital for 3 months and then in a wheelchair for 12 months.
Yeah.
I was put onto OxyContin about 9 years ago, and I'm completely addicted to it now. I'm under the pain team who can't offer me any support at all. And I just feel like I'm caught between a rock and a hard place because I'm still in chronic pain. But
just help me out, Sean. When you don't take your medication, what happens? How do you feel?
I get tremors. I get hot and cold flushes. I get really aggressive. It's even after I can take them in the morning, and within sort of 6 hours, I'm starting to get withdrawal symptoms. I'm not on a massive dose compared to some other people, but it's the addiction side of it that worries me more than the pain side. And there's just no support out there. My GP has basically said you need to come off them, but offers me no help in doing that, and offers me no alternative either. So it's just a nightmare.
Any suggestions, Ellie?
I mean, when you say the pain clinic haven't offered you anything else, have there been any sort of alternative treatments you've been offered in terms of exercise, psychology, other non-drug-based treatments?
They have referred me. It actually took me a year to get a pain clinic appointment referral. Within that time, I've sort of funded myself. I can't work full time because of my injuries. I'm having to fund everything myself, like physio appointments, yoga, various acupuncture. I've tried so many different things, which does not help my pain. And I know a lot of this addiction is psychological, but there is not a lot of support on the NHS, and I feel they've got me in this situation and just left me to deal with it myself, which I think is so wrong.
It's not a good story, Sean's, Ellie.
No, it's not. And Sean's really done, you know, exactly the right thing. She's tried the yoga. She's tried all the other things. You know, you can't fault you for trying all of those things. But then right back at the beginning in 2007, when she had that car crash, prescribing that medication, as we can all see, was the right thing to do, because she had terrible pain, a terrible situation, and she needed those painkillers. So we're sort of stuck there between a rock and a hard place.
But then there's the succession of failings, you know, a year to get a pain clinic.
Exactly, a year to get a pain
someone who's already got an established sort of drug history, you'd have thought as a result of a genuine, you know, injury, then you'd have thought they'd be top of the list, wouldn't you?
And weaning down from OxyContin actually can be done by a GP, it can be done by a pain clinic, but it takes time. Well, it takes time.
Then maybe we could say, Sean, that go back to your GP, if not the GP you saw last, somebody else in the practice, or go to a different practice and take Dr. Ellie's words with you and say, you know, I've been told you can help me withdraw and I need to withdraw. Help me, and see if you get a better result. I'll keep my fingers crossed for you, Sean, I really will. Storm.
We've got Simon on the phone from Brighton.
Good morning, Simon.
Good morning.
Good morning.
Love your show.
Thank you very much. Let's hear your story then, please, Simon.
It's been so long now, I can't remember, but it's over 10 years, maybe 11, 12, I'm not sure. I was cutting the hedge and I was in pain afterwards. I asked my wife to rub my back, and it never went away. I get nothing. I've had nothing. Virtually, I haven't even got a diagnosis of what's causing it. I've been 12 years. All I take is pills, 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 pills.
What kind of pills?
I take 4 lots of Zapain a day, 6 lots of gabapentin, 2 fluoxetines for depression because I'm in pain all the time. Thyroid pills, blood pressure pills. Oh God, I could go on.
and where are you with addiction? Are you addicted to these pills?
I don't know, because it's like, to me, it's like drinking a glass of water. I take the pills, I'm in pain. I don't take the pills, I'm in pain. So, you know, what do I do?
That is a dilemma. That is a dilemma. I know firsthand what that feels like, Simon. If you watched the show for a few years, you know I had spinal problems. Ellie, I mean, I feel for him because I found the NHS was absolutely hopeless. You meet a middle-aged man complaining of back pain, and I think the GPs just want you out the door as quickly as you come in.
Well, it's not so much that we want you out of the door. It's more, most people who have back pain, not in your case and not in Simon's case, but 90% of people who have back pain have a simple back pain which will get better after 6 weeks.
Okay.
And giving painkillers is totally appropriate. We also do encourage people to move, and we encourage people to sort of gently exercise. And most people do not need scans, and you and Simon are the exception to that, certainly. I mean, Simon needs to have time, a double appointment, sit down with his GP, and you need to say to your GP, look, I'm on all these medications. What is actually going on with my pain? Can I be referred for an exercise referral so you can actually start doing some exercise? Can I be referred for psychology so you can actually start coming to terms with the pain and deal with it in a different way? And actually being proactive and showing you want to not think of your pills as just like a glass of water that you drink every day, but actually you want to tackle this, you're motivated. And actually it's really important that people know we don't want you on oxycodone. It's very expensive. People say to me online, oh, you're paid by drug companies to prescribe painkillers. Actually, we have pressure put on us by our CCGs to stop prescribing painkillers.
Interesting.
So if you go to your GP and you say, I want to come off some of these medications, help me, take a double appointment so they've got time with you, you really might get somewhere.
Okay. I was going to suggest, Simon, drop me a direct message on Twitter and we might have a little exchange. I might have some information to share with you. I don't know if we're going to have time. I'm told we've only got a minute left, and I think that's too brief to take another call. Is there anything you'd like to say to sort of conclude about the role of the NHS and GPs and painkillers?
Listen, I think sometimes we're in the situation where patients appear to want a quick fix and we want to give a quick fix. And I think it takes time with a GP who knows you. Patients have to be conscientious and keep coming back, which again is difficult because of access, but it needs to be a partnership. It's not all down to the doctor.
Beautifully put, a partnership. Great.